The Comprehensive Breast Program at Noble Hospital provides women of all ages with a full range of treatment options for breast-related care. Joining us to share more about one specific treatment option is Dr. Stephen Schonholz, Medical Director of the Comprehensive Breast Program at Noble Hospital in Westfield. Dr. Schonholz, it's wonderful to have you here.
Good morning. It's nice to be back.
It's obviously such an important topic to talk about technology and how far it's come, really. Now, has breast treatment changed a lot over the years?
Well, it has. It has gotten less invasive and more localized. Several examples of that would be, in the past, a treatment for breast cancer was a mastectomy, removing the entire breast. Now we have something called a lumpectomy, breast conservation surgery, where we only remove the cancer and normal tissue around it. Another area is removing lymph nodes. We used to remove all the lymph nodes from under the arm to see if cancer is spread. Now we can identify those lymph nodes where cancer goes to, and we only remove 1, 2, or 3 lymph nodes rather than all of them, and it can prevent swelling in the arm. The other new technology that we're having is when people have breast conservation surgery, not a mastectomy. People need radiation, and typically radiation is to the entire breast, not only where the cancer is, but all the normal breast tissue. Now there's something called accelerated partial breast irradiation. And what that means, it only radiates the area where the cancer was after it's removed.
Now, you're here to tell us specifically about this treatment option. How do you know if you're a candidate for this?
Well, when we look as far as the candidate who can have this done, we would say somebody over 60 years of age or older, but it's on an individual basis, so it can also be younger as well. Somebody that has a tumor around 2 centimeters in size, which is a little less than an inch. It is somebody whose lymph nodes are negative for any type of cancer. We have to make sure that the margins or the edges of the lump that we removed have no cancer, and the tumor is sensitive to estrogen.
And how would you define this procedure? Obviously, it's a long name. It may not be easy to quite understand just by hearing that.
A little bit of everything for accelerated partial breast irradiation. First of all, when we talk about radiation, it's usually given, the whole breast radiation is given a month after surgery. A partial breast irradiation can be given within several days. The radiation for whole breast is 6 to 7 weeks every day, Monday through Friday. The length of time for partial breast irradiation is only 5 days.
It's incredible. It's nice to hear that technology really is making incredible strides.
Absolutely.
It's amazing. Now, what starts the process?
Well, what starts the process is when somebody gets diagnosed with a cancer, whether it's on a mammogram, an ultrasound, or physical examination. We're the only breast program that is offering this to the women in Western Massachusetts. So what they do is they call Noble Hospital, the Comprehensive Breast Program, and make an appointment. And I sit down and we talk about whether or not breast conservation is an option. After that, we wind up talking about, if it is, radiation afterwards. And we talk about radiation as far as whole breast and partial breast, and talk about whether or not somebody's a candidate. We wind up getting an MRI on the patients. That's to see the size of the tumor and make sure that there's no other cancers in either breast. And then what we do is we set up a consultation for the patient with a program that does partial breast irradiation. And I'm proud to say that we have 2 hospitals we wind up working at. One is Hartford Hospital, and the other one is the Dana-Farber with Dr. Devlin at the Breast Treatment Center.
And if someone does decide that this procedure is right for them and they want to go ahead with this treatment, what is the first step in the process?
Well, once they've gone through the initial steps that we said, there's surgery, breast conservation surgery. We do a lumpectomy. And at the time that we remove the cancer with clear margins, we place a balloon in that cavity. And the balloon looks like this. Very easy to do. Kind of fills up the cavity, and I think we may have a video.
We do have a video that's very, very easy to understand and see how this procedure works.
This is the application catheter, and those struts is where the radiation goes through. So we can figure out radiation and reduce it if it's close to the skin or close to the muscle, and use more radiation if there's a lot of breast tissue surrounding it. So this is where the catheter goes in through a small incision. It gets opened up. Radiation can be given over 5 days. You can see those little ports where it's given, and the next part kind of shows you how much radiation is given. It can protect the skin so there's no burning, or protect the muscle. and the bone, so there's no burning as well. After the 5 days, we slide the catheter out, and it's done.
It's amazing how much less invasive that is than previous treatment options.
Yes.
It's really incredible, and you are the only medical center in Western Mass that's offering this
We
treatment.
are, and the reason why we brought this in is we really believe that women should have a choice. Not only the choice of whether or not they have the mastectomy or breast conservation, a lumpectomy, also a choice as far as lymph nodes, when we have to remove or when we have to do less, but also the radiation treatment. If you're a candidate for this, it makes it so much easier. So if you know someone, whether they have a new diagnosis, family member or friend, they can contact Noble Hospital at the Comprehensive Breast Program.
That's wonderful. It's nice to know that there are options, of course. So,
absolutely.
And it's amazing the area that we live in and how far we've come. It's really incredible. Thank you, Dr. Schonholz, for being here. It's great to have you. And you can learn more about the treatment options available through the Comprehensive Breast Program at Noble Hospital by visiting noblehospital.org.